Good afternoon, everybody. Thank you for joining me here today on my presentation. My name is Stuart Dean, and I am an information security advisor for Penn Medicine. Penn Medicine is one of the top 5 health systems in the US with 40,000 employees. As you can imagine, risk management and information security are a high priority for us at Penn Medicine, and it's our experience that I'd like to be talking about today. I think that it would be fair to say that we all carry out similar activities in our offices when it comes to implementing new programs, ideas, processes, and procedures. And some of the problems and some of the barriers that we experience while doing that, again, are very common for all of us to experience, and how we address those is the subject very much of this discussion. When groupthink dictates our path, we will hit barriers. And we've seen that very, very forcefully in our implementation. Forcing others to think like us instead of thinking like them leads to a stalemate, a locking of horns that really benefits nobody and doesn't facilitate success of a project. And finally, misunderstanding the impact of our intent leads to frustration. I've been there, I've made all of these mistakes at some point in my career, and I've learned from them, which has led ultimately to one of the most successful initiatives of my career, which was the implementation of Onspring into Penn Med. That's what I'd like to talk about today. That's what I'd share to you, and how the drive for positive change was made in our organization. Because it does not matter how beautiful that process looks on paper, or how fantastic it feels in your own mind, or how important you believe those processes are, or even how many executives stand behind you and support it. True success is dictated by the content, the system that carries it, being emotionally owned by your users. I'm going to walk you through my story at Penn Med, our journey of implementation. Penn Medicine has a security program that is only 3 to 4 years old, and as a result, our risk management process and program was very immature. I think, like a lot of organizations, we relied on numerous spreadsheets being saved in places like SharePoint or shared central drives, decentralized emails, a lack of consistency, a lack of control, and ultimately a lack of accountability. My role was to work to create a robust risk assessment system, a risk management and assessment system, in order that we could be compliant with our regulatory commitments with HIPAA, but also to ensure the protection of our patients' data, and their well-being in regards to their treatment. Ultimately, our goals were to use as much automation as possible to improve efficiency, to use workflows to ensure ownership and visibility, and to use reporting to lock in accountability. Our process for approaching this was threefold. In the first instance, we created a risk management system and policy to support that system. We drew together a small team of experts who were well versed in risk assessment and risk management from a variety of backgrounds, with the aim of taking into account that experience, mirroring the requirements of a framework, in our case NIST, and finally recognizing and taking into account our institutional experience and knowledge to make sure it was a smooth implementation. Once we'd done that, we translated that into Onspring, which, because of the extreme flexibility of Onspring, actually proved very, very easy. We were able to replicate all the decision points that we'd found or defined. We were able to implement almost all of the automation that we needed in order to improve the efficiency and speed of the system. And once we'd done that, we needed to generate content such as user documentation, notifications, and compliant data sets, question data sets. And we did all of that. And amazing, we ended up with a beautiful creation in Onspring that we were incredibly proud of. Fireworks were shot off, bands played, we hugged and cried, leapt about in jubilation, and we were very proud of ourselves. I may have hurt my arm patting myself on the back a few times. And then reality hit, because we had not appropriately set expectation with the users of our new solution. And it was a big challenge. That challenge comprised of big change. And people don't always react to change in the most positive way. We had users who refused to give up their preconceptions based on how the old system worked. They refused to give up the spreadsheet they'd saved on their desktop 3 years ago and kept sending it back to us with new risk assessments. We had people who just balked at the idea of the email system or having dashboards on a web portal. It was not easy for them to get to grips with. We still had legacy assessments still ongoing just because we transitioned to Onspring, or Penn IRM as we rebranded it, did not invalidate what was already ongoing. So what didn't help was we were running two systems concurrently, which even further confused the messaging that we were moving to a new platform. The messages, the notifications that we'd written in Onspring that made absolute and perfect sense during our development phase and the design missed the mark when they landed with users who didn't have either the same context as us or the same breadth of knowledge as us. Finding owners, the people we were holding accountable, felt a fear of the unknown, to the point of even sometimes avoiding owning surveys because of what might be inside, because they were worried they wouldn't be able to answer it, so they just avoided it. The natural human reluctance to be accountable for issues, especially when they didn't fully understand them. We made a decision quite early on that our findings were going to be owned by someone of a director level or above. And it's totally reasonable to expect a director to take accountability. However, if that director didn't have the technical capability or understanding of what we were talking about in the risk finding, that meant that the decisions they were going to be made were not necessarily going to be best for them, for the enterprise, or both. And finally, the leadership we were communicating to, who we were relying on to cascade messaging down to the troops at the coalface, didn't always do that. We found ourselves repeatedly being asked questions by the frontline team members dealing with requests that we knew we had briefed their leadership on, but that information had not got to the most vital people. I think you've probably all been there and seen those problems before. How we recovered from this experience is truly the most important part of this story, and it's what I really want to share with you. We very quickly recognized that we needed to make a change, and we looked at these complaints that were coming in and realized that these were a perspective and it was equally valid. That pushback was not the customer's fault, was not the end user's fault. It was ours, and recognize that was the first step. We needed to re-examine that that content that we had created at every level, incorporating in that feedback, even when we sometimes felt that that feedback was spurious or overkill, but we needed to make something that would work at the lowest common denominator for everyone involved. We then went out and found true leaders to work directly with us on our content and be champions in the key areas. we met directly with the primary use groups to give them overviews and break the change barrier. We needed to sell to them the virtues of the system, not just what was obvious to us, but how it would benefit them, how it would make what they needed more accessible, and basically better for them. What value did it have to them? The most difficult thing that I then had to do was to check my ego at the door. Those complaints, after all the hard work that was put in, felt very, very personal. And it was very easy to be defensive and to reject that feedback. But once we were able to take a step back and recognize that this was an opportunity for us to take the system forward, to make it even better than we thought it was, by making it more effective, we were suddenly moving at a pace and towards a goal that was really, really important. We sold the system and the program. We sold the system and the realization of the program as being very much dependent on our users. We needed to give them a stake in both the success of the program and a stake in getting credit for that program success. And this is still an ongoing process, but once we began working in that way, we saw that our users were becoming more and more competent and more accepting of the system, and supportive of it, and were able to spread that influence out further across the enterprise. We had to remember, as I said earlier, that it doesn't matter how beautiful my ideas looked on paper, or how great it felt in the team's mind, or how important we felt it was. And it didn't matter how many of the bosses said that it was good. The true success came when that content and the system we designed, Penn IRM, was being emotionally owned by our users, and they felt it was theirs as well as ours. Thank you very much for listening to me today. It's been a pleasure to be here, and I look forward to talking to you all on the QA.
Proportion-wise, it's actually very small. What we see, we do see people misusing it. We do see resistance. But of course, just like in any situation, it's the people who don't want to use it make the most noise. There's 80% of our assessments that go without a problem, go without a noise, go without any sort of complaint. So it's certainly now it's few and far between. And what we find is that although automation was ultimately our objective to make it as hands-free as possible, taking the time to talk to new users or new people coming into the system really helps smooth the way and gets them on board for next time. Every time we've done that, every time we've used that to build a relationship between us, the requester, and the system, it's been beneficial. And it's had much longer reaching benefits in that they come to trust the credibility and the goal and objectives of the team even more because we've made that effort to bring them in. Yes, the automation has been absolutely huge, but not just automation, consistency. So the system pushing everybody into a consistent pathway and a consistent approach. The fact that we have used it to create an automated end report, so whatever we use along the way always comes out in the same way. It saves the analysts having to write reports ad hoc in different ways. They all come out looking the same with the same sort of content, which is great. One element that we've been working on, which we've not been able to fully implement yet, just because there's a lot of complexity to it, is standardization of findings. So, for example, a very common finding is that a vendor doesn't currently have a business associate agreement, which is a requirement of HIPAA. There's no need for that to be rewritten every time that finding comes up. Instead, the system could automatically generate it. And that saves time just because of the shit, not because it's complicated, just because it takes time. And the automation of emails saves us having to manually schedule, manually follow up, and manually get dejected when we don't get answers. At least we have that ability to force accountability on our stakeholders. As for headcount, it hasn't affected headcount. It's just meant we've been able to keep up with the volume. We have done a huge amount of risk assessments since we went live with this, much faster than we ever did before. We were always behind. We were always catching up. And now we're proactive. Now we've shifted the focus away from always picking up the pieces to being able to get ahead of it. And we've always got visibility. So it hasn't affected headcount. It's just meant we've been able to do a much better job. We brought this in primarily for risk assessments and security risk assessments and for management of findings. We also use a branch of that, we use that process, but slightly deviate from it for security exception management, so process exceptions. But since we went live, our security operations team became very interested in using it for vulnerability management and vulnerability bulletins. So when they get a security, like a CVE or a bulletin, they were just producing a PDF that they were sending around. Well, we've been able to work to implement additional applications, create their own apps that will allow them to auto-generate targeted bulletins depending on who the assets belong to that are affected. And that's been a massive improvement. But something that came out in one of the breakout sessions yesterday, the biggest challenge we have is making sure we leverage commonality in the application. So they're associating bulletins and vulnerabilities to assets. Well, of course, we're doing assessments on assets at the same time. We want to make sure we're not creating two separate sets of assets. They should be the same ultimate database of assets, just being used by two different systems. And that is the problem, the ultimate problem. If that thinking is not joined up right at the start, you can end up duplicating effort, duplicating data, and you end up with a system that's not going to talk to each other very well, and you're wasting an opportunity. And the opportunity is that we can, if it's all together, we can really powerfully interrogate that data and use it consistently throughout the processes.